Good evening, everybody. I'm back, y'all. I'm back. Yes, so welcome on in to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I am Nurse Charlene. Yes. And tonight, because I didn't want the whole April to go out without doing at least one podcast on marijuana and everything, 420 just passed and everything. So I'm coming on to talk about marijuana, but I threw a little remix in there and stuff. And that is called medicinal, which means do you use it as a medication or is it recreational? I just get high and we puff pass and we have a great time. So that's up to you, whichever one you might be involved in or might not, or know somebody and everything. That's totally fine. But just giving you a quick little background on everything. My name is Charlene, and I've been a registered nurse for 22 years now. And I had the pleasure of being a nurse and taking care of a lot of people, and including myself, and stuff. And I found out that it's a lot of misconceptions to, yeah, Rosie. Okay. And stuff. So for 22 years now and stuff, I've been a nurse and stuff. I'm doing this, and I found that people, they rather ask a random person a question, look at TikTok, look at Dr. So and such, and all of that stuff. Try these new medications, mushroom coffees, sea mosses, and everything and stuff. So, what is a sea moss and everything? We'll get on that and stuff because we're going to be touching all types of subjects that have to do with us and what we put in our bodies. But along the way and stuff, I just looked at it and I had the time while I was off for 3 weeks now and stuff. I was off and I had the time to reflect on the podcast. What am I really doing? Who am I trying to talk to? I'm trying to talk to you, my fam, and other people that want to know what's happening and stuff. I want to be one of those people that can get in there and kind of bridge the gap. I'm not for any means saying that my podcast will help heal you or anything like that, but it will point you in the right direction. So if that's enough, that can save anybody's life, and everything by just pointing you in the right direction and everything. So before I get started, going all the way in and stuff, I wanted to read my podcast disclaimer. And it's new, so bear with me while I put myself together and and stuff, but it goes like follows. Medical talk in layman's terms with Nurse Charlene, brought to you by Your Body's a Snitch, Believe It, LLC. Okay. Welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illness are broken down into simple, easy to understand conversations. And this podcast is for educational and informational purposes only. While Nurse Charlene, me, is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Okay. Every person is different. Yes. What works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, medications, or lifestyle. If you think you may have a medical emergency, call 911. Don't jump on the podcast. Call 911. I'm going to call 911. I'm not going to call you. I'm going to call 911, and everything, or seek immediate medical attention. The views shared on this podcast are based on professional experience and general medical knowledge. presented in layman's terms, meaning keeping it simple so that somebody that knows nothing about the medical anything can understand and get something out of it for watching it. Um, the layman's term helps bridge the gap between healthcare and everyday understanding, if that makes sense. The views shared on this podcast are based on professional experience and general knowledge. Okay, so I just want to make sure that I did put that down there and stuff just in case. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. Okay, it's not the substitute for you going to the doctor. I cancel my doctor's appointment because I'm gonna go on the podcast. Nope. No provider patient relationship is established. So I'm not your provider, but I'm definitely a friend or a family in mind, and stuff to get some advice from. But I'm gonna still point you to the medical doctors and everything that have your information. You are responsible for your own health decisions. You gotta be. But this is a good way. This is a good start by finding out, getting educated and everything on how to talk to the doctor so that they can talk to you correctly. And remember, your body speaks. Your body's a snitch. Believe it. Listen to it. Respect it. And when in doubt, check it out with a medical professional. Thank you for tuning in and taking a step towards better understanding of your health. Okay, so I like that. And it's going to take me a few more practices before I get it all. This is live and stuff. So it's going to take me a few practices before I get it together and everything. But definitely, this is what we're doing and everything. So, wow, look at that. My little family coming on and stuff. It looks like as Rosie Granny Allen, that's my mommy and stuff. She's on here tuning in and stuff. Thank you, Mom. Brittany Scott, that's my daughter and stuff. Thank you, honey, for tuning in. And welcome on in, Miss Sandra. And I think T might be on also and stuff. Welcome on, you guys. And she said, welcome back. Miss you. Hello, Charlene, Nurse Allen, Rosie, and Brittany. Hello, Miss Sandra. Bless your heart. We still praying for you. We still praying, okay? And stuff. But thank you for coming on. And Auntie Josie, she said, hello, everyone. Glad to be back. Miss you all. We miss you too, Auntie. And also praying for you, Mildred, and the grandsons and everything, that everybody and everything will work its way out and stuff. So definitely thank you for coming on. And then also, what does it say? Rosie Granny Allen is watching. Praise the Lord, everybody. Miss you, Nurse Charlene. Thank you, Mom. I love you, and definitely I miss being on and stuff. So this is my element. I felt it when I even came on and start preparing and stuff and getting you a good subject together and everything. But thank you guys for coming on and stuff. Let's dig on in. So the excuse me. The topic is marijuana. Yeah. And it says medicinal, which means medication wise, or recreational, which means the fun time and everything. Excuse me. So, marijuana, cannabis, sticky icky, endo, what is it? THC, trees. I remember just a quick little blurb. My neighbor at my last place that I was living at, he walked on down the street and stuff, and I already knew, he had some little special moments or something, he's special and everything. But I just remember, and I never got it out of my brain, that he just said, "You got some trees?" And I just looked like, yeah, I don't get down, but okay, and stuff. I didn't know what that was about. Excuse me, I got a little itch. Okay. So we're going to say marijuana, And I always give definitions just to get you in so that you understand what I'm talking about. Is marijuana is a plant that contains many chemicals called cannabinoids. Oh, no. But anyway, the two most talked about are THC and CBD. The THC part of marijuana is the part that makes you feel high. You get high. The CBD part of marijuana is the part that doesn't make you high. So it's just as simple as that. CBD, good if you don't want to be high or recreational. THC if you want to be high and recreational and still get some help and everything. So marijuana products usually contain THC, sometimes along with CBD. That means they can have a mixture of both, the part that doesn't get you high and the part that does get you high. And they mix them together. And sometimes that's the best way or the most appropriate to take care of whatever the situation may be. The clear difference, trying to keep it as simple as I can, is this. I got a little grid and stuff, and I'm going to read it and stuff. And it's like the feature or what's happening and what it does. And then I'll tell you marijuana, the THC one that gets you high, what it does. And then the other one, CBD, and what that doesn't get you high and what it does. So the feature is it causes a high. Marijuana with THC is a yes. CBD is a no. It's mind altering. THC marijuana, that's a yes, mind altering. And CBD, that's a no, non mind altering. Okay. Just trying to get you to catch along with it and everything. Used recreationally. THC, weed, puff pass, yes, absolutely. It's common in that. And it's a little more rare, but it, in some cases you could use the CBD, but it doesn't get you high. So I don't know what you would use it unless you're using it in combination with the THC to get you, recreationally and everything. So then used medically, THC marijuana, yes. And CBD, yes. So you see, you can use weed, trees and stuff. And in certain instances, they can help not only just get you high, but they can help medically. But CBD alone can help medically on its own. It has to be combined together and stuff for them to just really take effect, depending on what symptoms you got, what diagnosis you got and stuff. So it all depends on what's wrong with your body and why are you even using it. And if you're not, if there's nothing wrong with your body, something will probably pop up for you. Just giving you a quick warning. So as far as addiction risk, marijuana or THC, there's a good chance that you can get addicted to weed, especially smoking it recreationally and everything. Whereas there's a low addiction rate for CBD and stuff. That's the medical kind. And the topic is marijuana, medicinal or recreational. So that's where this comes in at. Okay. And then legal status. Ooh, this one's tricky because everybody wants to know, like, we got weed shops all over, it's cookies over there and so and everything. Like, what are you? Oh, wait. Rosie Granny Ellen said, is it for your spite? Oh, appetite. Okay. I'm sorry. So Rosie Granny Allen said, is it for your appetite? Absolutely. But this is the trick. CBD is good, but a little THC added to it is better. And it will help you because the THC side, the one that gets you high, it actually helps you with the marijuana, and stuff like that. So those two together, they will give you just what you need to get your appetite. Excuse me, I don't know what's wrong with me. I don't know. I guess my body's snitching on me. I'm gonna go put something up in my nose because I got like a little allergy thing going on and stuff. So bear with me, you guys. We're getting it together, and I'm totally fine and stuff. So, legal status, marijuana or THC, it varies by state. So some people like, no, it's not happening. Whereas CBD is more widely recognized because it doesn't get you high. And it's more used for medicinal or medication purposes or something. Whereas THC, all they think of is Cheech and Chong or Snoop Dogg and the weed and all of that stuff. Auntie Josie said, could you get addicted to the cookie and gummy? Yeah, I'll be talking about that. But yes, and stuff because it's the inside the cookies and gummies and stuff. They put a combination of CBD, but it's that THC, which is the high product. So you'll start craving that too. And then every time you don't have an appetite or something like that and stuff, you're gonna want it soon after, like if you're not eating or whatever the situation might be, you're gonna crave it, and stuff. And it can lightweight, get you addicted. But it's more rare than not. It's more addictive if there's absolutely nothing wrong with you, and you do it to get high, at the kickback or at the party and stuff, and everybody's smoking and stuff, and you're doing it and there's nothing really wrong with you. Then yeah, after a while and stuff, you're gonna start craving, and then you're gonna want it more and more. You're gonna be in environments like that, and so therefore, definitely, that can happen and stuff. So yes, and then the other thing, Auntie Josie, you said, could you get addicted and stuff? It depends on who's making it. See, they have the stores where it's more regulated and stuff like Cookies, Garden of Eden, and all these other little cannabis shops and everything that's set up. And they have their own and stuff. They have what is it? Fruity Pebbles and Grandpa and all these funny names for them and stuff like that. But it's to get you high. Whereas brownies, cookies, all of that stuff. Whereas the other way around and stuff, if you're just doing like just CBD and stuff, that's where the lotion, CBD creams and stuff for back pain and stuff like that. So it depends on what you're doing. And like I said, you're more likely to get addicted if there's nothing wrong with you and you're eating these things and stuff and doing this stuff, for the high and stuff. After a while, you're gonna need it and stuff. So it does switch you up. So bottom line of all of those that I told you about, THC equals high feeling. You get high. And then CBD is no high, but more of a calming effect. It keeps you calm. It keeps you grounded and everything. Good questions, ladies. Okay. Is it medicinal or recreational? Is it medication wise, to help with the medical condition? Or is it because I want to be high and I want the blunts, I want to, I want this and that and stuff? What is it? Okay. So, I'm just trying to just reel you in and everything. So medicinal uses for both THC, which is marijuana, the one that gets you high, and CBD. So here comes Auntie and Granny Rosie Granny Allen and everything. It's used for in medicinal uses or medical uses and stuff. It's used for chronic pain. This is a big deal because guess who used it and stuff and had to find out. Okay. And stuff. I had to find out and stuff. And so it's also used for anxiety. More of the CBD is more common, but it's used to calm you down and stuff. And that would be the CBD part of it. But this is both. and stuff. And then in seizures, I don't know if anybody knows what an epilepsy is or a seizure. It's like a shake, but it's something neurological going on and stuff like that. But before I go into all of that, that's another podcast and everything. But it's used for seizures, especially the CBD portion. And then another one is it's used for nausea, like in cancer patients and everything. So CBD and THC, a cancer patient could benefit from the nausea part of, going through the process and everything and stuff. So it's actually smiled upon. And from just personal experience with my mother, who is uh, beat some cancer, beats tore it up, tore it up. I will not lie, and everything and stuff. She needs everything now, and so we're fighting all the other stuff that dragged her, and everything and stuff. So we still in this fight, but we're definitely across the finish line almost. We right there and everything and stuff. So that's where this comes in and stuff. So the nausea and like cancer patients and stuff, the CBD and THC is smiled upon. They actually have an oncology or cancer weedologist and everything that we were able to meet and everything. So this is real. This is the real deal and stuff. So then appetite stimulation. So there's a lot of things that can cause you to lose your appetite. Different things like, even having COVID and not having taste buds. And then when you get them back, they're all metally and all of this crazy stuff, there's other things like cancer again, and stuff that can cause certain things and cause you to have no appetite because all the medicine that they use to fight the big monster is also dragging you because they got to get a killer to kill a killer, and stuff like that. So it's a lot of work and everything and stuff, but definitely that THC inside in combination with the CBD is really good and everything, and it'll help kind of calm that part down and stimulate that appetite. And the FDA has approved it's called Epidiolex for certain seizure disorders, just in case anybody has dealt with it or a family member or something like that and stuff. They've approved some type of this medication and stuff to go with that. So definitely that. Welcome in, Miss Michelle. I hope you feeling better. I hope you home and everything and not at that other place and everything. But yes, welcome on in, my dear. Michelle says hi, everybody, and stuff. So also recreational use. And this is THC only, recreational use. That means the fun time at the campground or whatever, and stuff. Yes, thank you. Michelle says she's at home. Yeah, that prayer is everything, huh? Yes, bless your heart and stuff. We will still keep up the prayer line for everybody that gets on here and everybody that doesn't get on here. You in the prayers, definitely. Oh, okay. So you've been home for a while. Yes, that's good. She said she got home April 6th. That's wonderful. Wonderful. Good job. Because you a fighter. You definitely a fighter. I know you're a warrior in this medical field. So you see a lot and everything. So people use marijuana, THC, to relax. They use it to feel euphoric or high. And they also use it to socialize. Puff, puff, pass. We was in a rotation. We was getting down. Yeah. And stuff. Was anything hurting? You didn't have no nausea? Oh, you just using it just to be used? Okay. All right. To each his own. Okay. The recreational part is where this is where the misuse or overuse can happen. This means the addiction. This could mean the overuse of it, and all of that stuff all mixed together and stuff. So it's a big deal. It's definitely a big deal. So I want to do this because I have a habit of just speaking to the adult because I'm an adult, so I'm speaking to the adult, and I need to speak sometime to your children, and everything. And so I did this one because I thought it was important that, we just remember, we talk about it for us, but we don't talk about what the kids find at school and they in elementary, or something like that and stuff, that we got to really be aware of this and stuff. So I'm doing marijuana, THC, by age group and stuff, and what happens and everything, the risk. And so children to teens, that will be anybody from about 7 or 8 on up. I want to put it at 8 on up to 17. Okay, children and teens. Their brain, the risk of something happening bad for doing, some type of smoking weed or something like that, is their brain is still developing. So that puts them at high risk for everything bad to go wrong, even wronger, if that's a word. Also, they can have memory problems because they smoking like you, but their brain's still developing. So they didn't kick back their brain and stuff. Now they're going to be a little special needs, and stuff. If they start real early, or anybody that has, you'll see that they special. They know they're special, and everything. Also a lower attention span. So that's why she ain't going. She don't like school, and she like to disrupt the school and knock people over and punch other people's kids or something. Or he like to knock the heck out of somebody else to take the stuff off of him, cuss out the teacher and all of that stuff, because he can't pay attention. She can't pay attention. She a baby. And so that's where that comes in at. It's increased risk of anxiety and depression. Now, they ain't even been in the world a minute, and now they got depression and anxiety because they started doing this drug and stuff. And it wasn't, I get high, like, why my parents do it, why I can't do it. Yeah, your parents is parents. They old, or something like that, older than you and stuff. They gave birth to you, and stuff. So that's where that comes in at. But that's what's happening, and everything. So what else did they say? Oh, also, this is the big one, you guys. Auntie Josie and stuff. The risk group by age. Edibles can be mistaken for candy, and there's an overdose risk. What if they ate the whole pan of brownies that was mixed in with some THC weed and stuff like that, and a little, CBD or whatever, but mainly THC, because that's the part that gets you high, and the kid eat it. And then they pump in their stomach and all of that stuff. Like, it can go real bad and even cause death. Put your edibles up. Put them somewhere else. Cookies, gummies, brownies. They make butter. They make pound cakes. They make cupcakes and all of that stuff out of it. And you can get so high. Who got high, y'all? Ooh, ooh. Ooh, this here felt like it was about 550 pounds. I was trying it out on my mom, and I bit the gummy first, and then I gave her a little piece, and I had a piece. So she around there moping around, just creeping and stuff like that, but laughing at everything and stuff. So she kind of liked it. I'm laying up there, and I had my head back, kicked back, looking at the TV, and I couldn't move. My head was just like, it was like 400 pounds. I could not take my head off the pillow and sit up straight and stuff. And I was like, what the heck? So I laid there. I went ahead and made myself go to sleep, and I slept it off. And so when I woke up, I was able to go back to normal. Yeah, don't do that. And so what helps one person, guess what? There was really nothing wrong with me so that I could take one. And there was something wrong with my mother, so she was able to take it, and she didn't have the same effect as me. It helped and stuff. Yeah, it hindered me, and stuff. So the moral of the story is, if you don't need to, leave it alone. But if you already stuck on it, then start working on, how do I get off if you feel like you're addicted, or so on and so forth. So the moral of the story is, if you ain't got an illness, leave it alone. Leave it alone. There's so many other things you could catch out here. catch feelings and stuff. Okay. So CBD is still not well studied in kids unless it's prescribed. And that would be for a kid with some type of cancer or something like that. They got to have a serious condition and stuff in order for it to be prescribed to a child and stuff. And there is a lot of serious conditions out there where that can be happen. So then I want to skip on. That was kids. Believe it or not, that was kids. Now we're talking about young adults. That would be 18 to 25 years old. So that's a young adult, and 18, you just finishing high school, possibly 18, 19 or something like that and stuff on up and everything. So even in the 18 to 25-year-old, guess what? Your brain is still maturing. You still developing. You haven't got it all yet and everything, even though you feel like, I mean, I thought I had it all and everything and stuff because I had my first child. I was 18. Yeah, I didn't know. I had to faith around and find out and everything. We're okay now and stuff and over the years and stuff. But at one time, it was a very special. So definitely this is something to pay attention to and stuff. It's not as fun as it seems on these movies. Next Friday after next, and all of that stuff. It's very special and stuff. But the 18 to 25-year-old, that's a young adult and everything. Brain is still maturing, so it's a risk of poor decision making, doing what you thought that you would never do and stuff like that. Yeah, that's where poor decision making, addiction, because you still maturing, so your body is not all the way developed. Your brain is not developed yet. So if you're getting on down, you got to pay the consequences. Even me. And then there's also mental health issues, especially associated with the THC, the one that gets you high. So definitely that's something right there. And then skipping on to the next one is adults. And that's anybody over 26 on up to, 50s and something like that. And that will be THC risk for an adult. This is the THC, the high one, the one that gets you high. And that means impaired driving. So you're driving while under the influence. So that's why you almost hit that person, or you almost killed them kids in the crosswalk or something like that. Yeah, that's from that. Just because you're grown doesn't mean that you're grown enough to drive while impaired, or drive while high. Also increase heart rate and anxiety and paranoia. I could have swore I seen, yeah, I almost hit that dog. It wasn't no dog there. You see what I'm saying? So anxiety and paranoia. Whereas adults on CBD is generally safer, and it can still interact with some of your medicines. So it does have the ability to mess up other medicines. So I would behoove you to tell your doctor who's prescribing your medications for you that, hey, I do a little weed. Will there be an interaction here? Or you know what? Make them people at the pharmacy work. They want to always counsel you. Say, yeah, I be getting high and I'm on this, and this, and stuff. Tell on yourself. What's the most that can happen? You might save your life and stop yourself from killing somebody or something like that and stuff. So it wouldn't hurt. So THC or marijuana or CBD and stuff in older adults. The THC increases an older adult, granny, grandpa, and stuff or you, whoever, and stuff for falls. You can fall and break other things, and then now you got a whole nother problem that you might not survive. But it started with that weed and being high and stuff. Also, confusion. Well, we already got to worry about dementia and Alzheimer's and all these other things and stuff like that and stuff. And then you confused from the weed too. You just give yourself a double, triple triple whammy or something there and stuff. It's special. And then there's drug interactions. So grandma and grandpa, they own this, or older you or older me and stuff is on all these different medications for other stuff. And then this one want to interfere with our other stuff, our high or our CBD or whatever and stuff. Yeah. And stuff. Just check it out. And don't be scared to tell a doctor. They can't do nothing to you and stuff. Tell them. They might can help you and stuff and everything. So then I want to go into pros and cons. And I'm almost done, y'all. And stuff. I'm gonna do a little short one today and stuff. Hopefully it's short and everything. And the pros and cons. And that would be pros for CBD, the one that doesn't get you high. Pros: there's no high. That's number one. It may reduce your anxiety, that nervousness, that fear, and stuff that's in the pit of your stomach and stuff. So that's a good thing. It also can help with seizures or seizure activity and stuff, and just putting that out there and stuff for anybody and stuff. And then also it's an anti-inflammatory effect. So it actually calms down stuff when things are inflamed, like your knee is inflamed or your back is inflamed. Guess what? It hurts. It hurts. And it's probably inflamed, all those tendons and ligaments and everything that keep us together and stuff. So it is a problem. Okay. So Auntie Josie said, what about the drop? It's supposed to help you sleep. Is it the dab you're talking about, Auntie Josie? Because you said, what about the drops? Is it a liquid dropper of like CBD? Because one of them does help you sleep and everything. Yes. And stuff, if that's what you're talking about and stuff. But definitely let me know if that's what that means about the drops, or some type of drops or something like that, or dab or something like that, because you got CBD. Oh, yes, the liquid drops. Okay, so you're talking about the little dabs or something like that, or the little oil and stuff, and you could drop it under your tongue or something like that. Yes, and that will help you to sleep, and a peaceful sleep, not you having a nightmare in there and stuff. You get to rest and actually really rest your eyes and stuff. So yes, good question too, Auntie Josie and stuff. I said it helps with seizures and it has that anti-inflammatory effect. But also the pros for THC, the one that gets you high, the one that they use recreational. I get high, puff, pass. That one is pain relief. It can help with pain. So you see the difference, Auntie. You said, what about the cookies and the edibles? But also THC, if you're taking it and there's nothing wrong with you, you don't have no pain or really no problems, and you're taking it and you're starting to do it every day and stuff, yeah, you just crossed over. Welcome to pain and other things, because they're going to pop up, they're going to show up and everything. But if you already have something wrong with you, you'll be less high off the THC, because it's going to go to where it's supposed to go to and everything. That's just like narcotics and everything. If you're taking a Norco or a Percocet or something like that and stuff, if you're taking it and you actually have the pain or the surgery or the whatever is going on with you and stuff like that, then yes, it's not addicting if you're taking care of a pain or taking care of a problem and stuff. It's when you're taking it and there ain't nothing wrong with you and you still getting down and stuff, then you taking it to get high and stuff. So it's going to be a problem, and it'll open up doors to other problems and everything, if that makes sense to you guys and everything. So the THC, pain relief, it helps with nausea. It improves appetite. And can help some sleep disorders. So you hear that, Auntie Josie? It can help some sleeping disorders and everything and stuff. So that's a good thing. And that's the pros of THC, the one that gets you high, and CBD, the one that doesn't get you high, but they're both marijuana and everything. So then the cons of this, or the bad things that might occur, and THC is addiction. Yes, it can get you addicted. Memory problem. Yes, you're gonna forget everything. Where my glasses at? Where my glasses at? And they on your eyes, and stuff like that, and little weird stuff, will happen. You'll know it's gonna snitch. Also, anxiety and paranoia. You see them looking at me and stuff. You the one looking out the window. Yeah, they gonna look at you if they see the curtain move. You know what I'm saying? So I'm just trying to give you an example of some. And you think the government, they down the street. Yeah, they probably not. They don't care. but that's the whole point. And then also impaired driving. Driving while high, you're not going to see that deer. You're not going to see that possum or that raccoon or whatever and stuff, or that rat, or whatever and stuff. You're going to hit it. And it's most likely because I didn't even see it. Yeah, your reaction time slowed down. You high. You don't know if you playing the Space Invaders game or you driving, and stuff, until somebody you faith around and find out and everything. So that part. And it's very dangerous to drive while high. It's just like, okay, I'm gonna get to that. But anyway, CBD, the bad things about it, possible bad things, is it's not fully regulated. So they don't know the whole thing behind CBD and how it really, really works, but they trust it more than they do THC of marijuana. So that's one. And then it can interact with medication, certain medication, so it can render them useless. So sometimes it might behoove you to take your medicine first, or take your puff first and then take your medicine an hour later or something like that and stuff, just to kind of counteract that. And then also the quality of CBD varies. It depends on where you're getting it from. Somebody in their kitchen making it up, or you going to a cannabis club like Cookies, or that's the only ones I know, Garden of Eden and a couple other ones and stuff around here and stuff, Hempley's or whatever and stuff. So that's where that comes from. And so all products are not just pure and stuff, but the difference is, have y'all ever heard of a crack or meth a little store where you could go smoke crack or meth? Yeah, they're dangerous, and they'll kill you and everybody else you love and stuff like that. So that's the difference and stuff. So yes, while we can be dangerous if done the wrong way, and everything can be done the wrong way. But I don't see a store for just crack. I don't see a store for just, the other stuff, meth and crystal meth and all of that type of stuff. So that's where that comes in. So how your body responds. Okay, think of your body as a balance system that affects it. Your body kind of regulates what it's going to take in and how it's going to act to certain things, depending on how they made it and all of that type of stuff. Hey, turn that off, please. Stop, y'all. Stop. Oh my God. Sorry, you guys. Yes, I'm at home. Okay. Think of your body responding like a balance system that affects your mood, your pain, and how you take the pain and stuff. Sleep, appetite, THC turns the system up. So the THC turns the system up, and it causes a high. CBD helps regulate the system, and it doesn't cause a high. So that's why they look better at CBD than they do THC, because THC is closer to druggy drugs, and stuff like that. So just giving you a few your body is a snitch quotes, and everything and stuff. But it sounds good. Just listen to it for me for a second. And that is, if your mind feels foggy, your body is snitching on the THC overload. If your mind feels foggy, your body is snitching on the THC overload. Calm without confusion, that's CBD talking. When your reaction time slows down and your body already told on you, don't you drive. It's dangerous, absolutely dangerous. And then also, just because it's natural doesn't mean it's harmless. Your body will always report the truth. It's going to show up for you and you're going to find out. So then also you got myth versus facts. So the myth, marijuana is completely safe because it's natural. That's a myth. The fact is, so is poison ivy. It's natural, but that doesn't mean it's safe. You're going to be itching and stuff. So then you got myth. CBD and marijuana are the same. Fact. CBD does not make you high and THC does. Myth. You can get addicted to marijuana. Fact. You can develop cannabis use disorder, which is kind of like addicted to marijuana. It's a part of, THC is a part of marijuana and stuff. So, yes. Myth. CBD works instantly for everyone. Fact. Effects vary. Some people need more, some people need less. Dosing and quality matter. If they made it in their kitchen, in their home kitchen, along with all their other food and stuff like that, they're probably not the chemist that you want dealing with your drugs and stuff like that. So that's where that comes in. What else? One more. Driving high is safer than driving drunk. I mean, if I'm high, I'm good. But if I'm drunk, them people, they need to be crucified or something. Fact. Both impair reaction time and judgment. You can hit and kill somebody with weed, or you can, and being high and stuff, or you can hit and kill somebody drunk driving. So either way, it's a problem and everything. So that's where that goes in at. So I'm getting down to the end and stuff. So quick reality check for the USA and stuff. This is just for the United States. And that is marijuana is legal recreationally in some states, including California. CBD is widely available, but loosely regulated. Meaning it's available, but they don't know the full effects of CBD yet and stuff. But it still seems like it's a little safer bet than the THC and marijuana. ER visits related to cannabis, especially edibles, Auntie Josie, have increased in the past years and stuff. In the recent years, I'm sorry. And stuff, that it has increased, that they get ER visits because they're overdosing. They're eating too many brownies with weed in them and stuff like that. So that's a problem. And that's only us in United States. We don't know what the other states do and everything. So then the take home message, THC equals high plus higher risk for this and stuff. CBD is no high, but potential medical benefit. Both can be helpful, but only when used responsibly. If you're using them responsibly, especially for an actual medical condition, you got a better chance at winning with this, and everything. Whereas if it was you just sneaking around getting some from somebody and stuff, there's a good chance that you probably mess around and find out, or faith around and find out. I'll leave it at that. What else did I want to say? The take home message also says age, health status, and dosage do matter if they have to have this stuff, because there is some cases where children even are prescribed THC, CBD type thing for appetite stimulation and different things like that, from like childhood cancer or something like that and stuff. So it is, if it's regulated, you're safer. If it's non-regulated, you got a problem. because you don't know who made it and where they made it at and what they dropped on your dose or that batch or whatever and stuff. So you got to really be careful. Everybody don't know how to make it and do it correctly and stuff. So deal with the people that do and everything. Let me see what else did I want to say. If you're using it to treat a condition, talk to a healthcare provider. So if you're using marijuana derivatives like THC that gets you high or CBD that doesn't get you high, at least do it under doctor's orders and stuff like that so that you have a chance at getting through this. And so I just got my conclusion, and it goes as follows. Marijuana and CBD come from the same plant. Y'all, let me read that again. Marijuana and CBD come from the same plant, but they behave very differently in the body. One alters your mind, that would be the THC, while the other works more quietly behind the scenes, and that would be the CBD. The key is intent and awareness. Recreational use equals a personal choice with some risk. So just remember, it's something that you got to pay back if you're using it recreational. It might be fun now, and then when you can't get off and you can't live without it, it might be a problem. Just saying. Medical use equals it should be guided and informed. So don't just get out there all willy-nilly, on it and everything and stuff. And so one of my final words is, your body doesn't lie. Whether it's relief or regret, it will always tell the story. Okay, you guys? And stuff. So that was marijuana, medicinal, meaning medication-wise, or recreational, means I'm having fun, I'm high and stuff, and I'm just getting on down, and stuff. Yeah. Either way, and this is human beings, so it's not just women or just men, because I'm a woman on here talking and stuff. This is the part where I say that it's for human beings, and then it's not just for adults, because the seniors may do it, but also the little children may do it. 8 on up to 17, 18 through 25. And then everything in between there until you turn into a senior. So either way, choose you on top of everything. When you start doing this stuff and taking these medicines and doing this, this and that and stuff, choose you, because you only get one of you and everything. So I'm ending my podcast and stuff. I'm gonna read the comments in just a second and everything and stuff, but I appreciate you guys coming on. It's gonna take a little while for me to get back everybody on and stuff, because I was off for 3 weeks, 3 Tuesdays and stuff after a year and stuff. So the part about life's on all of us and stuff. So be calm with yourself. Don't judge yourself so hard and stuff. We're still navigating this. We don't know what we were supposed to do with us, and stuff like that. When I was born, I didn't know what Charlene was supposed to do, or anything like that and stuff. So it does matter that you just take the time out, treat your body nice. You will not be able to get a body transplant, meaning you get to go into another person's body or something like that and everything and stuff. So the moral of the story is, we got to take care of ourselves and just take the time out. And guess what? This is marijuana, and I don't smoke or use, right? And stuff, but that doesn't mean that somebody else doesn't, or somebody else that I know. So now with this knowledge that I'm teaching you, I'm teaching me also. So therefore, when we're out and about and stuff, then we know a little bit more than we knew before this podcast, and everything, so that you could look at other people that you see smoking, but you wonder why and stuff like that. That's where all this stuff comes from. My intentions are good. They are, pure and stuff. And I appreciate you guys coming on, and I'm going to keep on just hitting us up with all this good stuff. Also, if you come up with any ideas on subjects and everything, feel free to message me. I might not be able to get to it right away as far as the very next podcast, but I will signal to you or send out the signal that, hey, I'm studying up on it and stuff. So I'm going to present it at such and such time to make sure you get on and enjoy it. And so tonight I'm streaming live from via Facebook Live and also YouTube. On Facebook, I'm Charlene Nurse Allen, and then on YouTube, I'm Medical Talk in Layman's Terms with Nurse Charlene, and you could go back and look at past podcasts and everything and stuff, and just kind of catch up and stuff. There might be one that catches you that might hit a friend of yours, a family member, or something like that and stuff, and you wonder what's happening and everything and stuff. But the whole matter is to make sure that we are all informed so that we all make better decisions and stuff on our health and our choices and everything. So I thank you all that carved out a little time in your evening, Tuesday evening, to get on with me and stuff. I appreciate you guys. If you came in late or something and you didn't catch the whole thing, a few minutes after I get off live and stuff, you could catch the remix or replay. I keep saying remix and stuff, but the replay and stuff. This is a remix and stuff because you see my little board behind me. I'm still drawing. I'm still getting down, but also my little ticker right here and stuff. It says, Nurse Charlene wants you to hype her up. That means pump me up and stuff. Be my cheerleader and stuff. Say, go nurse, and stuff. Because it makes me feel good. And I start talking more comfortably and everything. Because remember, I'm a human being. I have to get over some things, and stuff. But I know that I'm doing the right thing by coming on and blessing you guys and blessing myself and everything. So I appreciate you. And then reading Rosie Granny Allen said, thank you for sharing this. God bless you all. God bless you always. Much love, mommy. Amen. Amen, mom. I love you too and stuff. And God bless you. And we're going to keep on doing this. We got to fight. And then also Josie Collier, or my auntie said, Josie said, thank you again for good information as always. And your hair looks, okay, so I got to give my shout out to my friend Portia. If anybody needs to get their hair done, she's a sweetheart and stuff. She actually came because I moved and stuff. She came to my house and did my hair, my daughter's hair, and even my mother's hair. She didn't lose all her hair during her chemo and cancer fight and everything. And so she was able to get her hair braided and stuff. And she is just happy and everything and stuff. So definitely I'll let you know about that. Love you too, Britt. And then also Raina, hey baby. You came on. She said, yes, girl, you got this. Love you. Thank you so much. I was nervous. I'm not gonna lie. I had to do breathing exercises and stuff because it's been a couple weeks, and stuff. But now we in and settled. You see, I got my little stuff set up. I'm gonna get fancier and fancier every time you see me and stuff. And yes, it's still the same things and stuff. We talking about every part of you, head to toe, your mental health, your physical health, your body, everything and stuff. We talking about it and stuff. We talking about weed. We talking about drugs. We talking about everything you can think of. If it got something to do with changing your life and stuff, we talking about it. We even gonna get on here and start getting a little financial health, because if your finances is bad, you start getting mad, you be ready to fight, and stuff like that. Okay, it's me. But anyway, we got to get it together and stuff like that. So I thank you guys and welcome on. If you missed anything, again, you can go back and watch the replay and stuff, like, tag, and share. Share with your family members and other people that would benefit from it and everything. Oh, yes. Raina said, yes, I need the financial help for real. That's right. I do too. That's why I was like, okay, it's just me. But you know what I'm saying and stuff. Don't be afraid. This is transparent, non-judgmental platform. I don't play that mess and stuff. You know, I like all my extra nurses on, getting down, talking about it and stuff, because this is how we get to the bottom of it. And then you never know, by just saying your piece or your experience, that might help somebody that's too scared to get on and actually make a comment, but they're watching and everything. I've seen it and stuff, and I've had people come up to me and say these words and stuff. So I'm saying all of that to say I'm signing off. It's the hour in and stuff, and I'm done and everything. But I appreciate you guys and stuff. Y'all go back and watch the replay. It's probably all types of nuggets and stuff in there. And yes, it just gets better as we go along. And I'm on Tuesdays at 7 p.m. every Tuesday, unless something happens, because life does life, you know, and everything. But thank you all. I got your numbers and everything and stuff, and I send my love out and everything, and everybody who watches and stuff. If it doesn't fit you, it's okay. It's not going to fit. One size doesn't fit all and stuff, but it might be somebody, you know, your neighbor, your cousin, your auntie, your uncle, you know, and stuff, grandpa, grandma, you know, and stuff like that. So it's somebody out there that might need to hear this and everything. So bless your hearts, and thank you guys for coming on. I appreciate you. I thank you for the participation. It just helps hype me up. You know, that's what I mean by hype me up, like the little ticker says right there and stuff. So y'all take care and be good to yourself. Okay. All right. Take care.